Bonjour. Welcome, everybody. Thank you for joining us for our Solvet webinar to discuss MYCOBAC. We're really happy that you've taken time out of your busy days to take part in this. My name is Dr. Scott Westlake. I'm a technical services veterinarian for Solvet. A little bit about myself. I was a dairy veterinarian in practice for 35 years in Tavistock, Ontario. And since retirement, I've come on board and joined Solvet in my new role. With us today as well is Dr. Dennis Nagel. He's technical services with Solvet as well. He's based out of Calgary. I want to just take a minute and make sure everybody's up to speed on what Solvet's up to and what these eye care opportunities present to us. So, driven by their shared passion and a desire to make a difference, the Ellefson family founded Solvet in 2009 to meet the needs of the Canadian animal health industry. Our family culture has resonated deeply with our clients. They appreciate our commitment to fostering relationships that extend beyond mere business transactions. Working closely with producers and veterinarians like you is key. Research and development are at the core of our journey. We firmly believe that the right product can make all the difference. By continuously investing in research in Canada, we strive to stay one step ahead and anticipate the future industry challenges that arise. That's also why we created this iCare program. So iCare stands for International Cattle Applied Research Education. The iCare conferences are chaired by key opinion leaders from the dairy industry that provide Canadian veterinarians with high-quality continuing education opportunities. Through a mix of live conferences and workshops, attendees will expand and enhance their skills and knowledge and at the same time be networking with colleagues from all over Canada. We're really pleased to have a good large group of us together today. This event provides a platform for researchers and practitioners to discuss the most recent innovations, trends, and concerns, as well as any current practical challenges and solutions adopted in the fields of livestock and animal welfare. So today I just want to give everyone a heads up. This presentation is going to be recorded, but during the presentation, your mic will be muted, your camera is off, and your opportunity to pose questions is available throughout the presentation through the question and answer capacity on the meeting. But live questions are really encouraged at the end of the presentation. Yesterday, it took a little while for the group to get going, and once everybody became comfortable asking their questions, we had a really good conversation at the end of this presentation. So I'll really encourage everybody to jump in and ask your questions. And for those of you who are more comfortable in French, Shannon Cousset is available to help with translation if you'd prefer. So today we're really very pleased to welcome Dr. Dave Ellefson. He's the Senior Director, Technical Services for North America by MEDA. Dave's passionate about animal health and the ethical use of products, and a key element of his role is helping customers understand how a product is used most effectively, and I know that you'll benefit from his experience in the use of MYCOBAC today. A former practicing veterinarian and a practice owner, Dr. Dave has a wealth of experience in animal health issues and a full understanding of the issues and concerns facing veterinarians and animal owners. So welcome, Dave, and we really look forward to hearing what you have to share with us today.
Thank you, Scott. I appreciate that, and welcome everybody. Thank you for taking the time to join us today. Today we're going to talk about MYCOBAC, our Mycoplasma bovis vaccine. My screen seems to be frozen for some reason. Oh, there we go. I think we're okay. Did it change slides, Scott?
Yes.
Okay, great. All right, here we go. So let's talk about mycoplasma as an organism first. As many of you are probably aware, Mycoplasma bovis is one of the smallest self-replicating organisms that we deal with as veterinarians. That presents unique challenges for us when we're trying to develop vaccines against this organism because it just doesn't have a lot of antigenic material. It's composed of a cellular membrane that has 3 layers, as you can see. some soluble proteins, some cytoplasm, some soluble RNA, some organelles, and some DNA, and that's it. And compared to most bacteria that we are familiar with as veterinarians, it's very simple and again provides us with very little antigenic material. That three-layered cellular membrane is really key to how this organism evades the immune system, and we'll talk about that as we go through this presentation and how we at Bimeda deal with that situation to provide you with the best vaccine possible. Of course, the pictures that you see on here, any of you that are doing dairy calf work or even feed yard work have seen a mycoplasma lung before, and it's very distinct and easy to recognize. Of course, the calf in the upper right is a polyarthritis calf, and a calf in the lower right, of course, is that middle ear infection that we see many times. MYCOBAC, as we've mentioned, is the vaccine that we have. It's an inactivated bacterin, and it provides protection against Mycoplasma bovis. I'm going to share with you some challenge data and some challenge work that was done with MYCOBAC, and I think you're going to be impressed with what you see. And the backbone to how this vaccine works is really the Reveal ATS, which is the adjuvant system that is used in this product. And we'll get into that in greater detail as we go through this. So what makes this product unique from the competition? Well, it's several things. Number one would be the isolate that's chosen. Number two would be how we propagate that organism. Number three would be how we formulate this vaccine. And lastly, how we present the antigen to the immune system. What makes it unique from the competition are the unique characteristics of the isolate that we've chosen. We've actually done gene sequencing to find the best organism that expresses the most outer membrane proteins in its capacity. And so what we do is pick that organism, and then we manipulate that organism as we grow it, and I'll talk about that here in just a little bit. But keep in mind, this is how Mycoplasma bovis hides from the immune system. Once the immune system adapts to a certain form of the organism, it's very much like a chameleon in that it changes its outer covering, and then the immune system doesn't recognize it. And it's these surface proteins that need to be accounted for as we develop a vaccine so that we have a broad spectrum product. There's also virulence factors that are involved, and that's why we have a whole cell product. Mycoplasma has the capacity for adhesion, for invasion into the cell, and each one of these are virulence factors. It produces metabolites like hydrogen peroxide. It also produces a biofilm, which helps it evade the immune system, and also recently has been found to be involved in cytokine manipulation, specifically gamma interferon and tissue necrosis factor downregulation. And of course, those are two key components in how an immune process or an inflammatory process is started in an animal in response to disease. And when that's downregulated, we don't have as good an immune response. So the vaccine strain selection is critical when you're putting a vaccine together. It's really important that you include all of these factors, but most importantly, you need to have an organism that has the capacity to produce as many of the known outer surface proteins as possible, and that's why we chose the master seed we did for this particular product. And again, it was sequenced, gene sequenced, and that's how the strain was chosen. So development. We use a unique propagation strategy when we put this vaccine together. Again, we manipulate the organism in the growth process by changing its conditions, and I can't go into the specifics because it's proprietary, but just know that we do several different things in the process of growing this organism, which is over a long period of time, so that we express all of these outer surface proteins and that they're included in the product. And of course, by getting a maximum heterogeneity of these surface proteins, we get a broad spectrum immune response in the animal. In the development stage, formulation is key. again, we're dealing with the smallest organism, one of the smallest organisms that we know of that's self-replicating. And because of that, we have to do unique things in order to maximize the antigenic material in each dose. Antigen presentation strategy is the last leg of the stool, if you will, that gives us a really solid product. We use an adjuvant system that provides for chemotaxis of antigen-presenting cells. We also know that it stimulates Th1 and Th2 response, and those of you that remember your immunology, Th1 is a cellular response. Now that's going to be important because remember, this organism has the ability to invade cells. And if we have infected cells, we have to have a cell-mediated immune response in order to clean up infected cells. It also provides for a Th2 response, which is an antibody response. And of course, that's going to be like, you can think of it like a submarine net, if you will. That's hopefully in the blood going to block the mycoplasma organism from getting to the cells and invading those cells. So it's a two-pronged approach, if you will, to preventing infection and fighting existing infection. Maximum exposure of the immune system to the antigens is something that we want, and the way that we do this is that we have a prolonged release of the vaccine in the animal once it's vaccinated, and this provides for robust immunity. Reveal ATS is the adjuvant that we use in the product. There's some key components to this adjuvant. It is a water in lipid type adjuvant system, so everything's encapsulated in lipid. Vesicle size is key in presentation to the lymph node and for entry of the vaccine into the lymphatics. And again, those constituents that are in this particular adjuvant provide for chemotaxis so that we get the proper antigen presenting cells to the vaccination site. And we provide for prolonged release so we get maximum exposure to the antigens. This is the label for MYCOBAC. And it's pretty straightforward. As you can see, it's a 2 ml dose, subcutaneous. We recommend day 0, day 7, and day 14 for vaccination, and we recommend that you alternate sides of the neck with each injection. Now let's talk about where the rubber meets the road. Let's talk about the MYCOBAC challenge study that was done in 2006. If you look at the table that's provided, you can see that in the challenge, when we looked at disease, 90% of the non-vaccinates came down with mycoplasma disease and needed to be treated, or they died from the infection. 100% of the vaccinates were protected. This is almost unheard of, and something that I'd be very skeptical of if I was a veterinarian, if I didn't see that the controls had a very high percentage of infection. The other thing that was looked at in this particular study is, so we've looked at, okay, can we prevent disease? The other thing that was looked at is, can we prevent shedding or movement of the organism laterally through a herd? So we looked at shedding by use of nasal swabs. And as you can see in the vaccinates, 12.5% of the vaccinates did shed, but 80% of the non-vaccinates were shedding. So that's 100% protective fraction for disease on challenge and an 84% protective fraction for shedding on challenge. Let's compare that to a product that I think you're being introduced to in Canada in recent weeks, and that's a product called Protivity. In the challenge work that was done for licensing that product, all the calves were euthanized and lungs were scored at 28 days after challenge. Their controls, the non-vaccinates, only showed an average of 16.5% lung consolidation. Any of you that are doing feed yard work or doing calf ranch or baby calf work and have posted an animal that has mycoplasma infection know that a much greater portion of the lung is going to be involved in 16.5%. So in my opinion, this is a fairly weak challenge. The vaccinates, on the other hand, showed 4.3% lung consolidation. So the company can claim 75% reduction of lung lesions. There are no indications in this study, however, of disease prevention. They never looked at clinical signs or prevention of disease spreading or shedding. So in summary, what makes MYCOBAC different from the competition is the fact that we've got an isolate that expresses those outer surface proteins to the maximum available degree. We have a propagation strategy which makes sure that those switches, those genes for those outer cell proteins are turned on and off, so that we get maximum antigenic material and heterogeneity of genetic material and antigenic material in the formulation. In the formulation, we have a very high level of antigen, so that we get maximum presentation to the animal receiving the product. And lastly, that presentation strategy is that we're going to attract those antigen presenting cells, and we're also going to make sure that we get that two-pronged response, that Th1, Th2 response, so that we have very solid immunity, and something I think that you can rely on. There's probably no more challenging organism to try to protect against than Mycoplasma. And the more we're finding out about Mycoplasma, the more we're realizing that it's probably involved in a lot of diseases that we haven't looked at in the past because of its ability to cause immunosuppression in the animals. In fact, Kansas State University went back and looked at their respiratory submissions from feed yards in Kansas and found that 85% of the cases were positive on PCR for Mycoplasma bovis. So we know that it's an organism that's present in a lot of disease situations that maybe we didn't give it credit for in the past. So we hope that this has provided you with some information, and I would welcome any questions you might have, and you probably have a lot of them. So fire away.
Dave, just to get us started, I thought it was really interesting yesterday when you introduced us to Bimeda as a company, and also to the origin of this vaccine and the vaccine line that Bimeda is shared with Solvet and bringing to the market.
Yeah, thank you. I failed to mention that today, and I appreciate you bringing that up. Let's talk about Bimeda for a moment. Bimeda was started by 6 veterinarians in Ireland in the late 1960s, early 70s. The company was purchased by the Tierney family and is owned by the Tierneys today. So we are a family-owned company also. In the grand scheme of things, I guess you'd say we're smaller than a lot of companies, but we're not real small. We do gross receipts of about $250 million a year, and we are present in 80 countries. But you spoke earlier, Scott, about the family atmosphere and the culture that is present at Solvet, and the same thing exists at Bimeda. Along with that, the reason that we purchased Texas Veterinary Laboratories, which is today Bimeda Biologicals, is that the individuals that were in charge of research and development there are cattlemen and scientists. They are Texas A&M trained microbiologists, virologists, and microbiologists, but they also have cattle herds. And their absolute mantra was that they were going to produce a product that was efficacious, not just get a license from USDA. And that's why you see such solid immunity on that challenge work that was done. They wouldn't sleep at night if they thought that an animal might not survive because of the fact that their vaccine wasn't as good as it could be. So really solid science behind what we have.
Thank you, Dave. That's great. And another thing I thought occurred to me after speaking yesterday is just a little bit of a contrast in the different approach taken between Protivity and MYCOBAC in regards to what a modified live, what I want to call it, bacterin, but vaccine brings to the table, and in contrast to what our inactivated vaccine does.
there's not a lot of information available out there about the actual formulation of their product or the isolate. So I can't really speak to that. I'm personally, I'd be a little concerned about I'd want to know how the product was modified, I guess. And I haven't seen any information on that. So what I do know about the product that we have is great, because Mycoplasma is such a slow growing organism, great pains are taken in propagation of this organism to maximize the antigenic material. Again, I don't know enough about the Protivity product other than the challenge work that I saw, which I just know that when I was in practice and I had Mycoplasma lungs, I certainly had a lot more than 16.5% involvement on average. So, but I guess time will tell. Proof's in the pudding, right?
Yep. Thank you.
I have a question in the chat. It says label starts at 4 months of age. Will they look at a younger age on the label? Also, may be hard to implement as a 3-dose regime. And how critical will the time frame be between vaccinations, that is only a week apart? Then DOI will be for the rest of the feeding period, I presume.
Great question. Many questions. Let's see. Shannon, tell me the first question again. I apologize.
No, that's okay. So label starts at 4 months of age.
Okay,
Will they look at a younger age on the label?
Yeah. So USDA provides that, or requires, I should say, that whatever age animal you test your product in, that's what the label needs to state. I can tell you that a lot of this product is being used in dairy calves in the United States as young as a week of age. Anything younger than that, we recommend that you go half dose, not because of any danger in the product other than a lot of antigen, and especially if it's straight Holsteins. As you know, baby Holsteins have a tendency to exhibit anaphylaxis, especially when exposed to a lot of antigen. So we recommend half dose if they're under a week of age, but we do have a lot of people going at 7 days and then at 14 days and then coming back again at 28 days. You asked about interval of vaccination. That can be varied, definitely. We like to get 2 doses in them as quickly as possible. Again, it's a very unique organism, and our experience has been those first 2 doses, if we can do those close together, we seem to get a robust memory response, and then we get a nice anamnestic response on that 3rd dose. You asked about 2 doses versus 3 doses. I get this question all the time. And our estimate is that you would probably have about 75 to 80% protection versus the real solid protection that we see with 3 doses. I think I answered all your questions. Did I?
Yes, you. That's great. Wonderful.
Okay.
Is there any other questions? And if there's anyone that feels more comfortable asking in French, please don't hesitate. You can also come off of mute and feel free to ask your questions if you'd like.
Dave, could you elaborate a little bit more on the adjuvant and the size of the droplets?
Yeah,
I think that's
okay,
kind of
so,
unique.
Yeah, I'll make a really long story a hopefully short story. The 2 individuals, Jim Bob Harris and Dale Weiss, I mean, these guys are brilliant in my estimation. But what they figured out was sort of the sweet spot, if you will, of vesicle size for antigen presenting cells to be attracted, and also for vaccine to get into the lymphatics. And that's, and we've actually done postmortems on animals after being vaccinated about 5 days post-vaccination, and you can actually follow the track along the lymphatics and then find the material in the lymph node. So, when I first heard it, I was like, yeah, right. But it actually turned out to be true. So, and for those of you that don't know, I didn't say much about myself. As Scott mentioned, I was a practicing veterinarian in an eight doctor veterinary practice, but my partners and I, my 4 partners and I, also developed a vaccine company, and that was purchased by what ultimately became Pfizer. So I've been doing this quite a while. I was with Fort Dodge for several years, and represented that company also. Does that answer your question, Dennis?
Yeah, that's sort of what because as far as I know, this is a unique type of adjuvant where the antigenic material is actually presented to the cells in the lymph node, or directly into the lymph node, rather than going via the circulation.
Right. Yeah, and that's also a key component to our other vaccine, which is ProBac, which has Mannheimia A1, Mannheimia A6, Pastorella multocida, and then also Histophilus somnus. And many of you right now are going, holy cow, 4 gram negatives in 1 dose, that'll blow their heads off. And that's what I thought. I'm actually in the cattle business in Virginia. We buy, our cattle here are not exactly famous for being the most immunocompetent or the best mineral status. We buy at local sale barns, and then we raise the cattle up. We have a feed yard, and we have a custom slaughterhouse and sell beef to people for their freezers. But the point is, when we purchased the Texas Veterinary Laboratories and they had that product, I was like, well, the only way I'm going to know about it is if I use it in our cattle. And so I sort of closed one eye and, injected 20 head, and they never batted an eye. And then I found out that it was because everything in those bacteria is encapsulated in those vesicles, and we never get the endotoxin in the circulation, and that's all back to that vesicle size again. So yeah, it also translates to our other products that we have in our product line, which Solvet is also carrying in Canada. Long explanation, sorry about that.
Any other questions that anybody would like to ask? Feel free.
I guess while we're waiting, Dave, would you make your comment on just developing protocols according to challenge, and also because of the nature of inclusion in vesicle, its suitability for co-administering with other vaccines.
Right. Okay. So I got the question yesterday. Can you give this product while vaccinating with other products? And yes, you can. Important to remember that Mycoplasma doesn't have a cell wall, therefore no endotoxin, right? So you don't have to worry about endotoxin stacking. Timing of vaccination, for years, I have sort of reverse engineered when I've made recommendations to practitioners or to producers, on when to vaccinate. And let's use a calf ranch as an example. Let's say that, we're seeing a big spike in myco at day 60. It's probably earlier than that, but let's just use that number because it's easy to work with. Then what I would do is I'd back up 2 weeks. And so now I'm going to be at day 30, or let's see, 14. Yeah, I'm going to be at day 46. And then let's say I want to have 2 weeks between my vaccines rather than 1, excuse me. So 46 now, I'm going to give my second dose at 32, and I could actually give my first dose then somewhere around 25 days of age if a person wanted to wait. Now, a lot of you are probably seeing issues with myco much earlier than that. But the point is, you want to reverse engineer it to the point where you're at 2 or 3 weeks prior to your maximum challenge with that last dose, so that you have really good, solid immunity when that challenge is likely to occur. And that's served us pretty well over the years. Is that what you were looking for, Scott?
Exactly, that's right.
Yep.
And to everybody on the call, I just want to encourage you to don't be shy. I've asked all the dumb questions I could possibly think of, and Dave's had lots of good answers. I'm learning things every time I talk to him. And, you know, by all means, Shannon and the rest of our TMs will help try and get you the answers that you need. If you don't, ask them today. And whatever Dennis and I can't answer, we'll put straight to Dave. So this is an opportunity to go right to the, oh boy, horse's mouth and get the answers straight. If you have a question you don't feel like asking, or you would like to ask, but you're not ready to, I'm pretty sure there's a number of people on this call who have the same one. So don't be shy. Please get them asked now so you have the information you need when you're considering how you're going to approach vaccination for mycoplasma.
One other thing, Scott, well, you don't have any other questions at this time, right?
No,
I do actually, but if
okay.
One of the questions is that I encourage, you can raise your hand, you can put your questions in the Q&A, or you can come off of mute. But in Canada, where do Drs. Westlake and Dr. Nagel see this primarily being used by the early adopters?
Well, right now we have a veal barn in Quebec that has a trial going on for us. So I would imagine the early adopters are going to be the calf ranches. So our beef on dairy calf ranches and our veal barns, I would say, would be the early adopters on that one. And I hope we've also got plans to run a feedlot study as well this fall. So I would hope that they would also be sort of in the next wave of adopters. We got a sort of a mini trial going on with my own calves where I vaccinated them at branding time, bled them and vaccinated them at branding time. When they come home from grass, we'll bleed them and revaccinate those ones, and then we'll bleed them again a month later when we get ready to sell, and to sort of give us some sort of idea if we can get some immunity into those calves, where the first shot would be, say, at branding time, but maybe the second one could be on arrival, and maybe that might give us a protocol to use in the feedlot. But whoever talked about the 3 shots in the feedlot, that certainly is going to be a challenge to do that.
Yeah, and in Ontario, similar sort of thing. We're in discussion with a large veal operation that ships 35,000 calves a year, and they're a beef on dairy setup, so they have quite a high challenge with mycoplasma. So we're just working at developing a protocol that's going to be most suitable to them. And I have another practitioner that's got high interest. He works in a 1,000 cow dairy that has very, very high genetic value cattle. They also have some ventilation concerns, and he's actively looking at adopting MYCOBAC in that herd, and a couple of other situations with people that are a 400 cow dairy and a 200 cow dairy that actually bring calves in to put with their own beef, or rather their own bull calves, and raise them either to veal or a larger setup that takes them right up to heavyweight. So those are the early adopters. It's certainly, as you all know, this is early for this vaccine in Canada. It's been in the US for, I guess, a decade and a half, or almost 2 decades now, wouldn't you think, Dave?
Yeah, around 17 years, I guess.
Yeah. And an interesting question came up yesterday why is it that all of a sudden we in Canada have an option for 1 or 2 vaccines, and really that's more coincidence than anything. The relationship that we struck as Solvet tries to broaden our product offering to meet more needs for Canadian veterinarians and producers has meant that we've partnered with Bimeda just recently and are bringing this vaccine that's been in the marketplace in the States for a number of years right now. And that coincides with the vaccine that Zoetis has brought out just recently as well.
I do have a comment in the question and answer. So mycoplasma has been a curse to the bison industry, and any trial work going to be done in that regard, bison feedlots would definitely be interested in.
Yeah, that's a true story. It's a primary pathogen in bison, meaning it's usually part of the complex in regular cattle, but it's a primary pathogen in and of itself, can be fatal in bison. We don't plan, unfortunately, just the economics, we don't plan on doing any trials, but we'd certainly be willing or interested in helping someone out that had an interest in working with a herd. We'd certainly want to sit down and discuss that, find out what the infection rate is in the herd, probably do some serological prevalence work prior to instituting a program. In other words, if we've already got infected bison, we're probably not going to do a lot of good by vaccinating. But knowing where they are and knowing what their prevalence rate is, we could certainly come up with a logical program, I think, to help.
Yeah, and yesterday you did comment that, in fact, quite a bit is used in bison in the U.S. right now. Is that not
right?
So
yeah,
yeah,
right.
Yeah.
That's our understanding. I mean, we don't have any contact directly with anybody, but what we hear is that, from distributor reps, is that quite a bit is going into bison.
And I think your comment in regards to as we've spoken together about a couple of the other situations that we're looking to get MYCOBAC into, your comment about establishing prevalence before bringing into facilities where there's a high level of mixing of cattle of unknown exposure.
Right.
For those of us in the field that are looking at bringing it into similar situations, it may be worthwhile discussing with myself or Dennis or Dave. Dave's quite available for consultation. What we want to do as far as establishing prevalence before adopting the vaccine, because we don't want the vaccine to fail through no fault of veterinarians' advice or adhesion to protocol, but because the horse is out of the barn before we ever got it, and then we shut the door.
Right. Yeah, and what it does is it if you have a high infection rate already, and you're vaccinating cattle that are already infected, it's going to make your vaccine look like it's not working when in fact it's too late, right? So we got to figure out the best point in the production cycle to stop infection and or spread.
Are there any other questions? Feel free to come off mute or to ask in the Q&A.
Oh, one other thing that we did talk about yesterday, and I think is something good to bring up, is about the shelf life once it's been opened. If you have, say, in a 100 cow dairy, they have to buy a 50 dose vial. So if you can talk about shelf life of the vaccine once it's been opened.
Sure, I'd be glad to. As long as you use aseptic technique, use a withdrawal needle, not a needle that's been injected into 10 head of cattle to withdraw the product, and store it in a refrigerator out of light. You can just observe the expiration date on the bottle, but just use really good aseptic technique when withdrawing it.
Perhaps you can just talk about the route of administration as well.
Subcutaneous, and as I mentioned, we recommend that you alternate sides of the neck between the shots. So first one left, second one right, third one left.
I do have a question that somebody messaged me. In terms of revaccinating, do you recommend vaccinating like a year later or a couple of months later for a booster?
Oh, yeah. Great question. So let's say that we're talking about dairy replacement heifers or something like this. So probably at about a year of age, when you would be starting your reproductive vaccines before breeding that heifer, that would be a great time. And then I would just recommend an annual revac. If you had a high prevalence in your adults in your herd, it all depends on the herd, and each situation is going to be different. This is primarily a calf vaccine, and historically has been used in terminal animals, not very much in replacement animals. But some of the dairies out in California do vaccinate their heifers that last time at a year of age before they start their breeding program.
Wonderful. Are there any other questions?
Another question from yesterday. Are we able to give MYCOBAC along with other vaccines at the same time?
Yeah, absolutely. Yeah, like I mentioned earlier, it's not a gram negative, doesn't have endotoxin, and so there's no fear of endotoxin stacking or anything like that. But if we're in a really young calf, especially straight Holsteins, which are really prone to anaphylaxis, we want to be careful, how many products we administer. And that's related to antigen and just how their immune system responds to it, not related to endotoxin or anything like that. But yes, in general, not a problem.
Shannon, are you still there?
My apologies. Yes, I am. There's no other questions in the chat, so I think we're all good.
Okay.
Well, terrific.
Thank you, everybody.
Thank you, Dave. Every time we talk, I learn something more, so I really appreciate it. And I just want to let everybody out there know that in my life and practice and in my new life with Solvet, Dave is tremendously approachable. He's I find in industry it seems like a great way to communicate is email. And so when I email Dave, I have to have my phone ready because pretty much every time he picks up the phone and just calls me. And that's his ability to be available is something that I personally really appreciate. And so that when we were first discussing having this webinar series, Dave's first response was, "Well, why don't I just come up and talk to them live?" And we chose to go with a webinar because of the time of year, and questions seemed to be coming up fast and furious as this launch took place, and thought the best way to get an opportunity for you people to get your questions answers was through a webinar. But I'm sure, well, I know already that Dave's going to be in country. He's not hesitant at all to get in his truck and take a drive. And so we'll try to create opportunities where we can for people who'd like to hear more from Dave to do so live and in person. And in the meantime, if you have questions that didn't get answered today, by all means, make sure that your TM knows. And if Dennis or I can't answer them, then we'll certainly involve Dave as well. Again, thank you, Dave. It's great to have you on board with us, and we really look forward to continuing to work with you and Bimeda bringing these vaccines to market. So if there's no other questions, we'll just thank everybody for taking the time out of their busy schedules to hear what we have to say about MYCOBAC, and look forward to working together with you to get cows vaccinated that needs vaccinated out in the field as soon as you're ready. So thanks, everybody.
Thank you.